The roundtable this morning is Dr. Maya Bass. Dr. Bass, good morning. Thanks for joining us here. There was a resolution passed by Congress 23 years ago designating June as Men's Health Month. And the purpose of Men's Health Month is to heighten the awareness of preventable health problems and encourage early detection and treatment of disease among men and boys. So here we have at the table, or at the roundtable, Dr. Bass. So welcome. Welcome to the Good Morning Enid, and the commissioner has some questions for you that put you on the spot, so make sure you know everything, right?
Oh, yeah, sounds great.
So what are some preventable measures that men can take to improve their health?
Yeah, number one, stop smoking. Right there, you do one big act and you can cut your risk for cardiovascular disease by 50% or more. You also cut your risk for cancer. The other thing people can do is work on their diet and exercise, making sure they're eating a healthy diet, and getting 30 minutes of exercise at least 5 days a week, and see a doctor. Even if you're not sick, a wellness visit once a year really does help you get access to preventative measures to help with your health outcomes.
Dr. Bass, from time to time we hear things about so-and-so took a test, or they went to a particular screening and they found out something was wrong. Or is there a difference between men and women then on the screenings, or what is the recommendation, I should say, for screenings for men?
Yeah, so there are different recommendations for women and men. For men, really, men need annual blood pressure and weight checks, and then depending on risk factors, starting at age 35, they should be getting their cholesterol and diabetes checks. Starting at age 50, they should be getting screened for colon cancer. And then starting at age 55, if they smoked for 30 years or more, they should be getting screened for lung cancer. And then starting at age 65, if they smoked or have a family history, they should be getting screened for aortic aneurysms.
And how do they screen for that?
Yeah, that one, it's an ultrasound, which is
okay.
a nice straightforward test.
Okay.
So the top three causes of death in men are major cardiovascular diseases, cancer, and then unintentional injuries. Yeah. So what contributes to these top three causes of death among men?
Yeah, so one of the things I think that makes men a little bit more susceptible to these is that they just aren't accessing health care as much as women. They also are less likely to have health insurance. And the smoking, sedentary lifestyle, that not watching a lot of TV, not being active, and eating a poor diet, all of those kind of contribute to the cardiovascular disease. And then cancer, like not getting those screenings that we just talked about, can definitely increase that risk, as well as family history and lifestyle.
Dr. Bass, in preparation for the interview this morning, I was looking at some of the statistics, and according to the Center for Disease Control and Prevention, it says women are 100% more likely to visit a doctor for annual exams than men. That really,
100%.
that 100%. I thought, whoa, that's pretty off the chart, if you will. But I thought, why is that the case?
Yeah.
That statistic, just kind of the wow factor hit me. So.
Yeah, I think.
Are we invincible? Is that it?
I think you think so, for sure. But yeah, I mean, as women, we've kind of been taught our whole lives. You go in, you get that yearly checkup,
okay.
And guys just weren't told that maybe, or just don't believe that they need that annual wellness visit, but they do. And maybe they do think that they're a little bit invincible and don't need the doctor unless something's wrong. But the other thing is the men are less likely to have health insurance, so that's a huge hurdle to get over, to get those annual wellness exams.
And you told me recently the increased number of patients that you have are
men. Yeah. Yeah, our practice has women providers at this point. One of the last male providers had just left, and I got all his male patients. And so I definitely had a lot of research and making sure that I was doing everything as well for my patients as I could. So I got a lot of information on men's health from that.
Well, undoubtedly, they read that statistic and said, hey, I'm going to go find a doctor.
I hope so, yeah.
So in 1920, women lived an average of 1 year longer than men. Today, that number is up to 5. Why do you think that is?
So I think that a lot of the reasons that we're getting longer lifespans is because we figured out medical science has kind of helped to cure a lot of the diseases that used to have people dying early. And now we have all these things that you can access, these preventative measures, we have these health screenings, and women are accessing them, but men aren't. So I think that there's probably a little bit of effect with that, making men's lives a little bit shorter. They also have the effect of men, because of testosterone, because of their makeup, do have a little bit higher risk for things like cardiovascular disease and certain cancers.
Is there any way that you can kind of summarize some general steps that men need to take to live longer, live better lives? I mean, you already touched on, all right, you got to quit smoking, you got to quit, you got to leave the cinnamon rolls alone. You know, you're taking the fun out of everything.
Yeah.
So how would you summarize this?
Yeah, so it's definitely smoking, just stop. But the eating a healthy diet, so that means lots of lean meats, lots of vegetables. Stay away from the fried foods, from the processed foods, from the high sugar drinks.
It's getting depressing, you know.
Hey, there's lots of vegetables are really fun, guys.
I'm gonna start crying anytime now.
Get some exercise. Go out. Do something for at least a half an hour, 5 days a week. Stop just sitting in front of the TV, because that really does hurt your health outcomes. And come and see a doctor at least once a year, even if you're not sick, just for a wellness visit, to make sure that you're getting all those necessary screenings.
Okay, this is not on our list, but you're from Philadelphia. It's a foreign country, right? To the east, Pennsylvania, that area there. Would you say that there's a difference in health in, say, geographical locations in the United States? Florida, Colorado, Philadelphia, New Mexico, or whatever?
Yeah.
Do you think there is, based on your experiences?
Definitely. There's a big difference, just because lifestyle here, where you have like a big farming community and you have a lot more changes in your weather than we do on the East Coast. That kind of adds to a difference. You also have just different bugs, basically. I mean, we on the East Coast, we have Lyme disease. Like all summer, it's just Lyme disease everywhere. And you guys don't even have, you haven't had a case in the last 10 years, which is great. For me, at least. But
that's because of clean living here in Oklahoma.
Yeah, exactly.
Yeah.
And it's just what you guys are used to, and your diets are a little bit different than East Coast diets, and activity levels are different. So that does add a little bit of change.
Commissioner, not to put you on the spot, but you're married.
Yes.
How does the husband? Is he part of this? Yes, I go to the doctor, or is he? Which category is he in?
He does not go to the doctor unless he's really, really, really sick. But I think he has the last few years been going for his wellness checkup. I think he does do that at least. But generally, no, he doesn't tend to go to the doctor often at all. You kind of have to make him. So, I can get through it. But he powers through that's his theory. He powers through it.
I do have a lot of chief complaints from guys. That is, my wife told me I had to come. That is why I'm here. And I'm like, great, you're here. We can work with that.
I think there's a mindset in Oklahoma, and not to stereotype us, but as a kid growing up in a small part of town in Oklahoma, everybody worked hard. A lot of manual labor. Mm-hmm. And so there really wasn't time for exercise. You worked hard, and that was exercise.
Right.
So the mindset said, well, I got to do 30 minutes of exercise 5 days a week. Nah, you come haul hay all day, or you work in the weed harvest, or you plow, or you just go feed the cows and stuff like that. That was the exercise. So there's this built-in of just hard work should take care. And sometimes it does, and sometimes it doesn't. So.
Yeah, it definitely, if you do have a really manual job, that does add to your exercise that you're doing. I think as people in Enid aren't participating as much in harvest, or certain people don't do that, and they have more sedentary jobs, that's, I think, where the issue is coming up.
Well, thank you for joining us all the way from Philadelphia to Enid, Oklahoma. To reach you, to contact your office, or what's a good number to call?
Yeah.
I think we can put that on the screen as well, or maybe we already have.
It's 233-2900, and that's our office and our clinic hours that we're open. And you don't need to have insurance. We have a sliding scale, so everybody's welcome.
And you're located out on 30th Street here in Enid, Oklahoma. At the round table this morning, Dr. Maya Bass. So, Dr. Bass, thank you for being here.
Thank you for
having me,
guys.
Wealth of information. And we'll complete our show and go have our cinnamon roll, right? So, thank you again.